Okay. Now about the movement of the ankle joint, one thing is, I didn't mention number one, the arterial supply and the nerve supply of the ankle joint. Arterial supply is anterior artery and the peroneal artery. Arterial supply of ankle joint is anterior tibial artery and the peroneal artery. And the nerve supply is deep peroneal nerve and the tibial nerve. Nerve supply is deep peroneal nerve and the tibial nerve, right? Now the spinal center is, write down the spinal center. It is asked even in the surgery OPD. Surgery class you will be asked in the surgery demo classes. The ankle center, right? L4, L5, S1 and S2. L4, L5, S1 and S2. L4, L5 is probably the dorsiflexion. S1, S2 is for the plantar flexion. Right. Can you remember the inverters and everters of foot? What are the inverters and everters of foot? Dorsiflexion is initiated by the tibialis anterior together with the extensor digitorum longus, extensor hallucis longus and the tibialis anterior. These are the dorsiflexors, right? And the plantar flexors mainly is the gastrocnemius. And through the tendocalcaneus, soleus also take part in the plantar flexion. So dorsiflexion is this one. By the tibialis anterior, you can touch your tibialis anterior tendon. In the examination of leg dissection, you will be given the tibialis anterior from here up to the ball of the great toe. Alright. Whenever you dorsiflex this, you will find that is your tibialis anterior is taut. Alright. So tibialis anterior, 4 tendons of the flexor digitorum longus and the flexor hallucis longus, these are the dorsiflexion, right? And if you plantar flex your ankle, you will find your calf muscles have become taut and the tendocalcaneus, this one is the tendocalcaneus, right? This is also, you will find this is also taut. The tendocalcaneus is made, as I have told you, there is a gastrocnemius, 2 heads of the gastrocnemius meeting with the soleus at its deeper aspect, and in between there is a thin slender tendon, that is the plantaris, just like the palmaris longus of hand, right? These 3 are known as triceps suri. So this becomes taut when this gastrocnemius and soleus act through this tendocalcaneus. All right, you make it plantar flexion and you will find it. Usually dorsiflexion and plantar flexion under normal condition is not more than 10 to 20 degree. Not more than 10 to 20 degree. And I have mentioned what is Motti's view of ankle joint. What is Motti's view of ankle joint? I have told you. All right. Now the injuries. How to examine? Ankle injury is very common. Ankle injuries are very common. Especially the ankle sprain. Sprain means it is the stretching, excessive stretching of the ligaments. Sprain means excessive stretching of the ligaments. Sometimes with tear of few of the ligamentous fibers. Sometimes there may be tearing of the few of the ligamentous fiber. If you find that there is pain below the malleolus, remember this term, if you find pain below the malleolus, not on the malleolus, over the malleolus, alright. So this must be a case of sprained medial malleolar ligament or the lateral malleolar ligament, that is the medial collateral ligament or the lateral collateral ligament. Got my point? And there is another thing called spinal fracture. If you squeeze the tibia and fibula at the upper end, if you squeeze the tibia and fibula at the upper end, there you will find that there is a fracture in the lower end of the fibula. There you will find there is a fracture in the lower end of the fibula. Alright. This is called springing of fibula. This is called springing of fibula. If you squeeze the upper end of tibia and fibula, you will find there is fracture in the lower end of the fibula. You will be able to find out the fracture in the lower end of the fibula. And this is called springing of fibula. Fibular fracture, which professionals suffer the fibular fracture? Which professionals suffer from the fibular fractures? Guess? Open your mind. Soldiers. No, that is march fracture. Soldiers suffer from march fracture. That is a second metatarsal. Soldiers do not suffer from fracture of fibula. A good guess. It's a good guess. But I want to hear from you. Who are the sufferers professionally? Who are the professionally sufferers of fibular fracture? Football player? Not at all. Football player mostly suffers the shin bone fracture. At first hairline fracture, next the gross fracture of the shin bone. Anything else? At least do some guesswork. There is no marks, but there is appraisal. No. Don't make haphazard answers. It is. Use your mind. Use your mind. Remember, dancers suffer from fibular fracture. It is the dancing profession that causes fracture of the fibula. Dancers suffer from fibular fracture. Right? So, I need to, what is the dictum of how will you examine a patient for bony or soft tissue injury? The dictum is look, feel, move, measure. Look, feel, move, measure. This is the dictum of examining any injured patient, right? And you will take a short history. What is the circumstances that caused this injury? Got my point? So you will ask the short history. How did you get this? How did you get this injury? Number one. Number two is you have to look into the area whether there is any shortening, there is any deformity. Alright, there is any excessive movement, or there is any, whether there is any restriction of movement, right? So this is the look, this is the feel, then feel. You will feel the area, whether there is any tenderness, any temperature, local temperature, there is any excessive boggy swelling anywhere, hematoma, like this. So look, feel, then move, then try to move the joint gently. In case of ankle joint, you will hold the lower end of the leg with one hand, and your next hand will take the foot, and will try to move this either in favor of the injury or against of the injury. Right? So, look, feel, move and measure. Measurement is not that much important in case of ankle joint. Measurement, even in case of leg also, measurement doesn't make. So, the measurement in relation to the ankle joint is not that much important. Is not that much important. What is important is, that is called tuber joint angle. Tuber joint angle. That is from the head of the first metatarsal to the point of the calcaneus, that is the heel. Alright. From the head of the first metatarsal to medially to the point of the knee. This is one line, and another is from the head of the fifth metatarsal to the point of the calcaneus. Alright. These two meets by the angle between these two is roughly again 20 degree, and if there is an upward thrust, pushing the talus upwards, there could be, the angle could be up to 40 degree. Alright. This is much important to differentiate by at first looking or touching the ankle. You must be able to discern whether there is a fracture in the talus, in the medial or lateral malleolus, or in the calcaneum. Got my point? Could you follow me? By looking at the ankle as well as by touching the ankle, you should be able to understand whether this is a sprain ankle, whether there is a fracture of the ankle joint, bones around the ankle joint, and whether this is a fracture of the calcaneum. Right? Now, if the talus is fractured, there will be pain. And how the talus is palpated? In between the gap of the medial and lateral malleolus. You should push deep in between the medial and lateral malleolus. Alright. And your thumb will go towards the neck of the talus. Alright. So there will be, if there is a neck fracture, there will be excruciating pain in this region. Right. And remember that the widening of the ankle is caused by the upward movement of the talus. So the tibia and lower end of the tibia and fibula will be separated out, and there will be widening in the ankle joint, and that is already due to what? That is the anterior part of talus is wider than the posterior part. Alright. One thing more is, that is the center of gravity of our body pass just a little in front of the center of the ankle joint. Center of gravity of our body passes just a little in front of the ankle joint. Right? So there is always a tendency that the bones of the leg slips forward. Isn't it? The bones of the leg will slip forward. This is prevented by two things. Number one is bony, another is muscular. This part is important, you should remember. Alright. So there is a tendency to fall forward, and which is prevented by a bony factor and a muscular factor. What is the bony factor? As I have told you that the anterior part of the talus is wider. So this is prevented, this prevents the forward skid. Another is the tonic contraction of the tendocalcaneus. Tendocalcaneus is holding the knee joint from the back. It's preventing the forward skid. It is preventing the forward skid. So you should remember these two corrective anatomy. Now another thing is that ankle fracture occurs when your foot is grounded or anchored with the ground and the body moves with the momentum. With the momentum you have been moving or you have been thrown into injuriously. This movement of the upper part of your body, when the foot is grounded, foot is anchored to the ground, your ankle injury will occur. Your ankle injury will occur. Suppose your foot is fixed in a hole that I have said you, golf injury and the ski board injury. In the ski board injury also your foot is fixed to the ground. In the golf injury also your foot will enter into a hole in the ground. Right. So the heel or the lower part of your foot is fixed to the ground. Now your momentum of your speed, momentum or any injury, momentum of your body or any injurious violence will take your body to the front, to the back or to the side, medially or laterally. This is the point of injury of the ankle joint. বোঝা গেল জিনিসটা? Could you follow this? When your foot is grounded at a hole, in the hole, suppose in a golf hole, or your foot is fixed in the ski board, and now your body takes the momentum, and there is the injury. There occurs the injury. Now the ankle injury has been earlier classified by Lauga Hansen. You have never listened to this term. Write down. Lauge. He is a German. Lauge. The pronunciation is Lauga hyphen Hansen, Hansen, Lauga Hansen classification of ankle joint. Lauga Hansen classification of ankle joint. Number 2, Weber classification of ankle joint. W-E-B-E-R, Weber classification of ankle joint. Oh, in between, grossly, the ankle joint can be classified by the internal rotation injury, external rotation injury, and the vertical compression injury. Internal rotation injury, external rotation injury, and the vertical compression injury. Always remember that the fracture line extending vertically upwards represent the vertical compression injury. Alright. When the femoral fracture line or the medial malleolus of the tibia is fractured in the horizontal plane. When both of these, you can see that there is vertical fracture line also together with the horizontal fracture line. Then you will understand there is, this is not a simple adduction injury or abduction injury. There is the external rotation injury, abduction injury, adduction injury, or the internal rotation injury. There could be vertical compression fracture. Today my time has exhausted because of late starting of the class. I will draw the picture of this diagram to make you understand what is the loop of the adduction fracture, abduction fracture, and the cross fracture of the calcaneum. All right. Okay. Let me finish. Okay. Let me finish with this, and I will continue on it. All right. Thank you. Thank you, all of you.